Managing childhood fears and anxiety. Childhood is a time filled with wonder, exploration, and learning, but it can also be a period marked by fear and anxiety. Children often face various fears, from common childhood anxieties about the dark or monsters under the bed to more complex issues related to social interactions, school performance, or health concerns. Understanding and managing these fears is crucial for a child's emotional and psychological well-being. Fears in children are a normal part of development. They can arise from a variety of sources, including a child's imagination, experiences, or even media exposure. For instance, a child might develop a fear of thunderstorms after experiencing a particularly loud storm, or might become anxious about separation from parents after watching a movie depicting a child lost or abandoned. Such fears typically emerge during specific developmental stages and can vary significantly from one child to another. Recognizing the difference between normal fears and anxiety that requires intervention is essential. While many childhood fears are temporary and diminish as children grow, persistent or overwhelming anxiety can affect a child's daily life, relationships, and academic performance. Signs of anxiety in children may include excessive worry, avoidance of certain situations, changes in eating or sleeping patterns, or physical symptoms like stomachaches or headaches. To effectively manage childhood fears and anxiety, parents and caregivers can take several proactive steps. First, fostering open communication is vital. Encourage children to express their feelings and fears without judgment. By creating a safe space for discussion, children may feel more comfortable sharing their worries, which can help demystify their fears. Asking open-ended questions about their fears can also help children articulate their feelings better and understand that they are not alone in their experiences. Another important strategy is to validate the child's feelings. Let them know that it is okay to be scared or anxious, and that these emotions are a normal part of life. This validation can reduce feelings of isolation and shame, making it easier for the child to cope with their fears. Additionally, teaching children about emotions and how to identify them can empower them to manage their feelings more effectively. Gradual exposure to the fear source can also be a helpful technique. For example, if a child is afraid of the dark, parents can start by dimming the lights gradually rather than turning them off completely. Reading books or watching movies that address similar fears can provide comfort and normalize their feelings. Engaging in role-playing scenarios can also help children practice coping strategies in a controlled environment. Mindfulness and relaxation techniques can be beneficial tools for managing anxiety. Teaching children simple breathing exercises, such as deep belly breathing, can help them calm their minds when faced with fear or anxiety. Activities like yoga, meditation, or guided imagery can also promote relaxation and provide children with coping mechanisms they can use in moments of distress. Additionally, establishing a routine can create a sense of stability and security for children. Predictable schedules help children know what to expect, reducing anxiety associated with uncertainty. Incorporating calming activities, such as reading before bedtime or having a consistent wind-down routine, can also foster a sense of safety. Parents should be aware of their own responses to childhood fears and anxieties. Modeling healthy coping strategies and maintaining a calm demeanor can influence how children approach their fears. If parents exhibit high levels of anxiety or fear in similar situations, children may adopt those same responses. Encouraging positive coping strategies and showing resilience can help children develop their own ability to manage fear and anxiety. In some cases, professional support may be necessary. If a child's anxiety interferes significantly with their daily life, seeking guidance from a psychologist or counselor can be beneficial. Therapeutic interventions, such as cognitive behavioral therapy, CBT, can equip children with skills to manage their anxiety effectively. In conclusion, managing childhood fears and anxiety involves understanding, communication, validation, gradual exposure, mindfulness, and sometimes professional support. By providing children with tools to cope with their fears, parents can foster resilience and promote emotional well-being. As children learn to navigate their fears, they gain confidence and skills that will serve them throughout their lives.